Welcome to the virtual open house for the Robert Morris University. I am Dr. Holly Hampe. I am the program director for the Health Service Administration program at Robert Morris University. And I have a wide variety of colleagues on this virtual table, and we are going to be talking about the graduate program tonight. What I'd like to do now is share my screen with you, and I want to show you some information regarding our program. And this is the list of all of the people that are attending tonight's presentation, and you can see there are a wide variety of individuals from many different areas of healthcare. One of the things that, people, when they're looking to go back to school for either a bachelor's degree or a master's degree, they have some fears. And these fears may be they're not able to do the work, or they're not able to excel in the program, or they don't have enough or any healthcare experience. Been out of school way too long to go back to school, not sure about an online program, and not able to enjoy life while going to school, and no fun times anymore. Well, whenever you're looking for a program, be it a bachelor's or a master's program, there's certain things that you should look for. You should be looking for a reputable university, looking for a university that has a supportive school or academic administration, looking for credible faculty that get it, faculty that have worked in healthcare for a number of years. And if we look at Robert Morris, my colleagues and I have over 75 years of healthcare experience. National recognition, and I'm going to be talking about that in a few minutes. Classroom style, individual or cohort. In our graduate program, we have a cohort, and that means that you are with these same individuals for the entire length of the program. And so not only are you learning from the students or from the faculty, you're also learning from the students that are in the cohort. So we found that the classroom style in a cohort fashion has lent itself greatly to a more enhanced and well-rounded education. Looking for evidence-based curriculum, and you'll find that with our program that we do utilize this evidence base to make sure that it is based on things that are happening in the industry. Student focus program, making sure that the faculty are there for you, that whenever you email them, that they're going to answer. A flexible format. Our graduate program is 100% online, and we'll be sharing with you the technology that we have and also some simulation that we do. We also have a dedicated advisory board. You should be looking for a program that has a dedicated advisory board. Our advisory board meets twice a year, and many of the individuals that are around this virtual table are on the advisory board, and that advisory board helps to provide us with a sounding board, provide direction for the program, give us a pulse check on what's going on in the industry, so that we're constantly in a dynamic situation, always constantly changing the program to meet the needs currently. It's not something that we developed the program 15 years ago and it's the same program today. Have established networks for internships. And we're going to be finding out throughout the program tonight the importance of internships and how Robert Morris is excelling in this area. And also academic resources. What does the university provide you? Is there a career center, which we have at Robert Morris? Is there online support? We have at Robert Morris. So you want to make sure that there's going to be support and resources for you. Our accreditation with our graduate program, we are accredited by the Commission on Accreditation of Healthcare Management Education, which is CAMI. Our undergraduate program is certified by the Association of University Programs in Health Administration, or AUPHA. So this is very important when you're looking at a program. This is the Good Housekeeping Seal of Approval, which many of you may not know what that means, but it is a stamp of expertise or application of the standards that they have, that the program has met what those outside organizations have established to be important in a program. For our graduate program, our mission statement, and I'm just going to be talking about the highlighted areas. Our program transforms highly qualified, diverse healthcare professionals within varying levels of experience in leaders, looking at advanced skills. Our graduate program is aimed to make you a middle to upper management individual. The curriculum incorporates the quadruple aim, which is the Institute of Healthcare Improvement, and also looking at evidence-based leadership principles. There's very, very much an emphasis on internships, and we're again going to be talking about that in more greater detail, but looking at those individual opportunities and getting that bridge from your being in the classroom to getting your first job. And everybody's going back to school to get a job. And we also provide with a variety of healthcare experiences. It's not just hospitals, it's all types of healthcare organizations. Our graduate program is 42 credits in length, and you can see in the first year, you're learning, getting a basic understanding of what it means to be an executive in leadership, looking at performance improvement and quality. Preparing for that internship which will be in your second year. Strategic planning. We do have a lot of focus on accounting, budgeting, finance, because we really feel that that's important for an administrator. Not only the quality and performance improvement, but you need to have finance. So having that balance and looking at logistics, operations, law, policies, and politics. Also in the second year, we continue that education, and we're looking at population health, evidence-based decision-making, looking at information systems, negotiation, interprofessional development, ethics and legal issues. And in that second year is when we do the internship, and we break it out into 3 different areas so that you can continue to work full-time, but you can do your internship, which is 1 credit is 40 hours. We do utilize a number of different teaching methods, and we have discussion boards which are written in video. We have day in the life interviews, which many of the people around this virtual table have participated in, finding out how they got to where they are. They just weren't born a CEO, that they had a journey to get there. We look at weekly learning summaries, case studies, reflective papers, blogs and journals and readings, and financial and analytical problems. And I'm going to hand it over to my colleague, Dr. Jillian Harrington, to talk about the technology that we use in the classroom.
I just want to talk a little bit about what we do from a technology standpoint. I think in the realm of online programs, which obviously this master's program is fully online, we tend to be a little more on the cutting edge than a lot of our colleagues out there. And we're using, most programs use a learning management system. We happen to use Blackboard. So if you've taken online classes in your undergraduate program or perhaps in another graduate program, you may be familiar with that. That's going to house our written discussion boards, assignment drop boxes, quizzes, those types of things. But also, we do make use of the Blackboard Collaborate Ultra virtual classroom. So it's really like being in a live classroom, except virtually, much like being in a Zoom environment. But we have things like whiteboards and breakout rooms and lots of opportunity for us there. But we do go beyond that. So one of the things that we had implemented a while back was a move from a written discussion board to a video discussion board. So we use a product called Flipgrid, no additional cost to the student, but it is a video discussion board product where instead of typing out a 2 or 3 paragraph discussion board in Blackboard, you'll actually have a live, not live, asynchronous video discussion with your colleagues. So you'll post up a video about your topic and you'll post responses to your colleagues. So really interesting way to build community in the classroom and really have a good dialogue about some important healthcare topics. We also implement some serious gaming and simulations. And Dr. Frendek's going to talk a little bit about some of the simulation we do in the Synchronous environment. But we do some of that asynchronously as well, taking part in simulations such as cybersecurity, HIPAA, data analysis, some areas that we fit into other classes that we have throughout the curriculum to give you some hands-on experience in some of those areas. And then finally, the last thing I'll mention is Edpuzzle. We take videos that could be a video of ourselves doing a lecture. It could be a video from YouTube, a video from another healthcare professional, and we apply to that some additional learning opportunities. So maybe quiz questions, maybe some discussion area type questions where you can put some text in there. Just a way to enhance your video learning opportunities in the online setting. And also just, these are just a few of the things that we do. I myself, and I know my colleagues as well, I am constantly searching for the latest and greatest new and interesting technology that allows us to engage our students in the classroom. be it online or on ground. Obviously, our master's program is online. So especially in the online world for you guys, to try and make it a little more interesting, kind of mix things up for you and keep you interested as we move through our 8-week classes. So I'll pass this over to Dr. Frendak to talk about the synchronous learning opportunities.
Thank you, Dr. Harrington. We love our synchronous learning opportunities because we really get to know each other and get to see each other and get to learn from each other. We have a whole different repertoire of synchronous learning opportunities, which could include the students doing presentations of their projects. There's practical applications in some classes where they're applying the concepts to a work scenario, such as a quality improvement project or a Lean Six Sigma type experience. We sometimes have students share their key learnings, and that is awesome for each other to kind of hear from others what they learned and to share across the class. The root cause analysis simulation is particularly popular because we have a patient safety experience, and we actually go deep into it and roles, and different people can play different roles and identify where we might see system issues, and we can talk about the blame environment and just culture and a variety of the cultural aspects. And we've had the opportunity to do that exercise with international students from Scotland. We have the beer game, which I'll be doing exactly 1 week from today with our logistics and operations management students. That's a classic supply chain simulation game. There's no beer involved. It's just the type of product that we're hypothetically trying to provide. And in the finance class, one of the finance classes, Accountable Care Management and Finance, we actually do a board of directors simulation. We do a combination of other experiences that we get together, case study analysis, again, some practical examples, debates, sharing of the internship experience, etc. And I'll turn it back to Dr. Hampe.
Also, our program provides international opportunities for our students. Healthcare in South Africa is an opportunity for students to go faculty-led education abroad program, visiting Johannesburg and Cape Town and looking at different hospitals within each of those areas. And the students have found this experience going to a third world country to be very beneficial to their understanding of healthcare. There's also the opportunity to healthcare in Australia at the University of the Sunshine Coast, and able to go there and see how they do healthcare. And also they do some simulation in their cave, which is a automated virtual experience. So it's a great educational experience for students. Some of the strengths of the Robert Morris program: we are number 18 out of the top 25 best online Masters of Healthcare Administration program from the bestschools.org. We also number 44 out of the top 52 best healthcare administration programs of 2019. Our program is flexible. It's a completely online environment. There's a cohort style. We have no more than 23 students in a cohort. Faculty support and dedication. We've got major networking opportunities through myself and my colleagues and the experiences that we've had in our careers, as well as our advisory board, as well as the connections that we have made throughout the time at Robert Morris. We also have the academic resources. As I said, we have our career center, we have our online support services, so that provides you with that additional needed support whenever you're going to school. And finally, our internships, and we're going to be talking about this again, but it's a supported internship, it's a well-structured internship, it's a focused, it's customized for the student, and we're able to break it into 3 40-hour segments so that you can you can work full-time and continue to do your internship. So I'm going to stop sharing my screen at this time, and we are going to start some discussion with our esteemed individuals around the virtual table. We're first going to start out with some examples of health service administrators' roles. And we're going to start with Ken DeFuria, the CEO and president of Butler Health System, as to what is a healthcare administrator and why would you get into healthcare administration?
Thank you, Dr. Hampe. I'm not sure there's a clear answer to that question. what is it or why would you do it? Either one of those. You know, as many healthcare jobs as you can think of, there are healthcare administrators. So literally thousands of opportunities across the country, across the world. I happen to be in a somewhat traditional community health system, a hospital system. But while, you know, we have a couple hospitals, we have about 75 or 80 outpatient locations, hundreds of physicians across specialties, and just people with backgrounds, you know, that are all over the map. So in health and services administration, you're going to work with, of course, fine clinicians, but finance experts, legal experts. In my particular role, I often say I really never know what day is going to bring, really. It's just a wide variety. I think the curriculum that was just presented by the faculty is, you know, I could see a prospective student scratching your head and say, why would I need that? There was probably nothing on that list that I don't tap into on a pretty regular basis. As an example, ethics. Here's a discussion I never thought I would have. Early on in the coronavirus pandemic, all of you heard the concerns about PPE and drugs and ventilators. I found myself early on in that experience sitting in a room with physicians having a discussion about, you know, and thankfully this didn't happen, but what if we didn't have enough ventilators for all the patients who needed them? What would we do? That's a very serious ethical question. There's literally questions of life and death. And certainly something I never thought that I'd be grappling with. And as I said, thankfully that never came to pass. But these are the issues that as you move on in your career and take on different responsibilities, you just never know what education experience you might have to tap into somewhere along the way. And, you know, I'll just finish with this. Working in healthcare, I don't care what you do. I think working in healthcare is an incredibly gratifying job, period. We are taking care of people. I don't know what is more noble than that any of us can choose to do. And I would encourage anyone who's pretty seriously interested in it to pursue it. They'll be glad they did.
So obviously Allegheny General Hospital is the flagship of Allegheny Health Network. And I think that in my experience with Robert Morris and with leadership in general, I think that building your network and making sure that you know the people that are out in the field so you know who to call and you can get the information you need, especially at times when crisis is upon us, is absolutely essential. And what Robert Morris does extremely well is that they stay incredibly tied to the local networks of healthcare professionals and also regional, national, and international healthcare professionals. So the experience that the student gets is that they can tap into that very broad network. I've had multiple students myself who have done internships with me and from Robert Morris, and they have been incredibly well prepared coming into the internship, but I think that they had a great opportunity to apply what it is that they're learning in the classroom to the real world, which is where all of us on the call live. So it's a really wonderful opportunity for students, and it gives them that chance to form their own network. And I often say that your network is probably the most important group of people that you have in order to be able to do better work for patients, because you have to be able to go outside of your own health system or your own world in order to really understand and provide the best care that you can provide. And Robert Morris excels in helping people build networks. And that's across every major, and it's especially true within this one.
Thank you, Margie. John Lasky is the Chief Human Resource Officer at Temple University.
Hello, everybody, and thank you, Dr. Hampe. Yes, I'm in Philadelphia. Those who have been there know it's a wonderful and historic and vibrant city. I'm in the North Philly section of town, and those of you who've been there know that that's a bit, it's very underserved, probably the deepest poverty pocket in the United States. But yet, for a boatload of reasons, we find ourselves on a national stage in healthcare. I want to tell you the part that I play in that. I lead the HR group. That's the people end, the people focus of the business. There are three major things that we focus on. One is finding and hiring the absolute best team members. We base that work largely on science and data and not too much hunch. Our goal is to identify the people who match our mission and who have the skill set and the real potential to make a difference with our patients and with our team. Our view is everybody is clinical. It doesn't matter what your job is, whether you're swinging a mop or transplanting lungs. Everybody has a piece to play or part to play in the medical process, and our job is to find the best of them. Secondly, our job is to develop those employees, all 10,000, more than 10,000 of them, so that they can reach their fullest potential and unleash it on improving medical outcomes and patient experiences. We do that by developing new programs, new training programs, improving new programs, so that all of our employees can play the biggest role possible for them. And then finally, it's on constant improvement. If you're paying attention, you know that, and I'm sure you are, you know that healthcare is changing radically. 5 to 10 years from now, it's going to be very different. Healthcare delivery will be very different from what it is today. Our job is to get there first. So we find and prepare all of these folks to go out and do things like heart and lung transplants, and to the other end of the spectrum, which we're equally proud, where we do population health. We work with people before they go into these wonderful big box hospitals to make them as healthy as possible. You know, we have a team of 65 people in HR. I think every one of them working together would say this about our work. Yeah, it's hard, but you make a difference every day, and you feel that you've made a difference every day. People count on you as well. They count on you for the regular things, but they also count on you for the extraordinary things like we're experiencing in COVID-19. It's a very rewarding career, healthcare administration. I'm thrilled to be in the HR end of it, and thank you for allowing me to have my say.
Perfect. Well, we talked about the program. We talked about being a healthcare administrator. The bridge that gets you there is that internship. And Mark DeRublis, the president of Premier Medical Associates, he has served as a preceptor for many of our interns. And I'd like to have him talk about what it's like to do an internship at Premier.
Thanks, Holly. Yes, we have precepted quite a few of Robert Morris's students, and we have been very impressed with their preparedness, but also the well-rounded nature of that preparedness. As many of the speakers have said this evening, healthcare is changing rapidly, and one of the characteristics of that change is a vast migration from an inpatient setting to an outpatient setting. And being that it's so new, I was quite pleasantly surprised to see how prepared many of the students were to really address things like, large data analysis, data-driven care, algorithms and the like. What's so new about our business is probably, pre-Obamacare, the physician practice business was still probably considered largely a cottage industry of small businesses. And now, it's predominated by larger organizations that are still finding their way and their direction in this business. Care is moving from a situation where not only was the physician the quarterback, of course, but they were pretty much the whole team. And now it's very driven by team-based care. And they're still the most important part of that team, but they are on a team. And that concept is new to everybody, especially the physicians. So there's not much of what we're doing today that isn't new, that isn't cutting edge, and we're still finding our way. So it's a very exciting time to be in healthcare. You can pick very different aspects of the industry, to dive into, and doing an internship at Premier Medical Associates is something that will give you exposure to all aspects of really the outpatient, physician-driven side of the business.
Great. Thank you, Mark. You know, with our internships, we really focus on that customization of it. And, you know, as a student, you're able to do 3 different areas of an internship, fall, spring, and summer. And so it's an opportunity to get 3 different areas of focus. And Tanya Ulrich is one of our adjunct faculty in the program, and she has served also as a preceptor for our internship. So Tanya, if you could talk about doing an internship at Presbyterian Senior Care.
So Presbyterian Senior Care Network is the largest long-term care senior services organization in Western PA. And we have 8 campuses, home health, we have supportive housing, and so on. So there are many, many opportunities for a student to gain some exposure to various areas that would be outside of a traditional hospital setting. With the faculty, we meet with the students to really understand what they're looking for and then how we can best deliver on that internship opportunity. It is truly a customized approach. I would say that no 2 internships have looked alike from my perspective. We're really able to customize based on the student's interest. So it'd be one thing to do an internship in, quote, HR. Well, there are many areas of HR, and you know, so we've had students come in that I've been involved with that maybe were focused on talent acquisition. Another student was focused on compensation and benefits, God love her. And then we had another student who, you know, was very interested in really just HR operations, employee relations, and just all those things that happen kind of a day in the life in HR. So there's many, many opportunities to customize, and even outside of HR, you know, there's a focus on quality and patient safety and other areas as well that as students have interest, we're able to put them with a preceptor that would be best equipped to meet their needs in an environment that is of interest. We have long-term care, we have personal care, we have home health, we, you know, have a number of settings in which these experiences can be provided.
Thank you, Tanya. I'd like to shift now to Lisa Parizo. She is a graduate of our master's program, and she can give a little insight as to how it is to be a student, why she selected Robert Morris as her program to go to, and what she has done with the information that she's learned.
I was exploring different programs in the area, and I knew that I wanted an online program so that I could continue working and be successful in my career and be a successful student as well. In exploring the different options that were available, I met Dr. Holly Hampe, and after having an interview with Dr. Hampe, it was a no-brainer. I knew I wanted to go to Robert Morris University for this online program. The university has a great reputation, and the support from the faculty is phenomenal. I'm not sure you would get that type of support from other programs. It was a very satisfying and unique experience for me. Satisfying in that I was successful in my career. I was successful in my studies. And you do get to live life a little bit during those 2 years. My husband and I hosted a French exchange student. Our daughter got married, so there was a wedding, and we renovated our kitchen. So life goes on, and you can manage it very well. What is unique about this cohort format is that you get to meet different folks in different areas of healthcare. Members of our cohort, we had insurance specialists, we had a PACU nurse, we had an office manager, and we had a couple of younger folks who were just had just finished up their undergrad. With this different mix of people, you get different perspectives, and it truly opens up horizons for you. So you get to explore subjects as a group, but also you get to do some individual research. And an example of that is, I'll never forget the day, I don't even know what I was looking for, you know, in regards to assignment, but I stumbled upon an article about community paramedics in Texas. And one thing led to another, and I just kept looking at these articles about community paramedics, and I was so intrigued. And so at the time, Dr. Harrington was the instructor, and I was telling her about that, and she said, my husband's a community paramedic. So she helped me find an internship where I got to go to a community paramedic academy for a week. And I get goosebumps now. I still, it was an incredible experience. And so when you talk about internships and you get goosebumps, that's how important they are, how much you learn, how much you become invested in, you know, different areas that you can explore. The other two internships were just as fabulous. I got to spend a week at the Villa of St. Joseph's, and I got to work with a wonderful executive director, Mary Murray. Her leadership style is just fabulous, and it helped to support my notion of servant leadership. The third internship was the fellowship in death and dying with the Jewish Healthcare Foundation. And we need as a society to look at death and dying a little differently. With my time off, I've been doing a lot of reading, and I just finished a memoir called When Breath Becomes Air. And so as the, you know, these topics stay with you as you go along, and you continue to learn. And I miss my cohort, and I miss the discussions. And luckily, I stay in touch with Dr. Hampe, and the networking events are fabulous. I endorse those. You'll learn a lot. You'll meet wonderful people face to face. And if you're looking for a great online program, this is it.
And Lisa, you have also on our advisory board, which we put students on the advisory board to continue to provide us input into the program. So we didn't let you go. We continued to around, which
Thank you.
Very much appreciate that. So shifting gears to the question you may have now is like, how do I apply? How do I get involved in the program? And, you know, we have two excellent admissions individuals with us, and I'm going to start with Jessica Dunkel. Can you tell us what the admission process is? And then I'll have Samantha talk about the finance part of it.
So if you are ready to jump in with 2 feet, we say great. We welcome it. We invite you to apply. So it's really easy to do. Just go onto our main website. It's www.rmu.edu. In the upper right-hand corner, it says apply now, and you can just click on that. So the application itself, it might take about 15 to 20 minutes, very basic information. And then we'll start collecting all of your credentials. So once you apply, myself or Sam will reach out to you, letting you know which person you're going to be working with directly. So we'll need all final and official transcripts, a current resume, an essay on why you wish to earn the degree and to be in healthcare administration so we can learn a little bit more about you. 2 current letters of recommendation. We just ask that they're professional in nature. And then you will have a phone interview with Dr. Hampe as well before she ultimately makes that decision. So once we have all of your credentials, we have a pretty quick turnaround. So maybe about a week to 10 days, and we can get you an admissions decision. So it's a fairly easy process, and we're here to help you walk throughout that way.
And then I can hop on for the financial aid information. So as graduate students, financial aid looks a little bit different than what you were probably used to at the undergraduate level. So what you're applying for, and you apply through the FAFSA as you did previously, but you are able to borrow up to $20,500 a year, and those are federal student loans. And we also have a graduate financial aid counselor that works specifically with our graduate students, and her name is Sarah Hurley, and we can definitely get you in contact with her too. The other popular thing that we have a lot of our students coming through is called corporate reimbursement. And this is a program that you pay $25 at the beginning of each semester, and it actually allows you to, your bill won't be due until 30 days after grades post. So if you're lucky enough to have your company paying for your graduate program, you're able to do this. And it's really nice because it allows you to take that time to get things settled with your company. The other thing is we do offer a lot of corporate discounts. So if you go to the RMU website and you type in RMU corporate discounts, there will be a whole list of different corporations in the area that we've partnered with to be able to offer students 15% off of their tuition. Some of them have different verification forms that you might need to submit, but a lot of them we just need an email from your work account and we can get that applied for you. If none of those companies are companies you work for, we also have partnerships with some professional organizations, and those are listed on that page as well. A couple of the really popular ones that we see: Pittsburgh Young Professionals, Pittsburgh Human Resources Association, Young Nonprofit Professionals of Pittsburgh. And these are professional organizations that you can join for less than $100 a year, and they're going to save you about $5,000 on your program. So that's also the 15% discount. You can't stack a corporate discount and one of those organization discounts. You can only get one, but they do end up being really helpful. And a lot of them have other great things too, you know, networking events, mentorship opportunities too. So it's not just about the discount. But that's all that I have. I didn't, Jess, is there anything that I missed on the financial side? Okay.
So I don't need a GRE or a GMET to get into the program?
You do not.
So this is our time for question and answer, and I've got a few questions here. And this goes out to our administrators. We've got Margie and Ken and John. A question is, why did you select going into healthcare administration?
I sort of backed my way into healthcare administration. I'm a lawyer by training, and I was practicing law. Took a new job with Allegheny Health Network, Margie's place, as a senior counsel. And as much as I really loved practicing law, it became evident to me really quickly that I could make a bigger impact, sustainable impact, if I crossed the bridge from doing the legal work to actually doing being on the operational end, being a healthcare administrator. And for all those reasons I said before, making that important difference and people counting on you was the right move for me.
I certainly didn't plan to be an operations person when I first went into nursing. I mean, I'm a nurse through and through, and always will be. I think that because I saw when I was in nursing and at the bedside, I saw many things that I thought that I could help to contribute to and help to change. It made me want to progress into leadership so that I could make that contribution and make it better for all of the nurses that I worked with. So I think over the years, the more that I've worked in leadership, the more that I've appreciated what it is that leaders do and have continued to progress in that area.
Perfect. Ken?
I wholeheartedly agree with both what Marguerite and John said. I think the difference is it is the impact that you can make and really kind of see the results of hard work. And you know what, you really get to work with some incredibly smart people too. Every day, I'm amazed at the smart, engaged professionals that are part of the team. And it is a team. Somebody said earlier, this has gone from at least for the doctors, an individual game to a team sport. It really has. And that's fun. All of us have been involved in one type of team or another. And you know what a high performing team feels like and looks like and what that means. And as you get into healthcare leadership and administration, that opportunity is there, and it's very gratifying.
Perfect. This question is for Lisa. Can I go to school and work full time? And is that a possibility?
Absolutely, without a problem. So you give up evenings, that's okay. You develop a routine. Every evening after dinner, I would just go sit here at my desk and work on what I needed to work on. I kept lists. So every Wednesday I knew I had to have my discussion ready and posted. And then I knew, you know, Thursday, Friday, Saturday, I needed to respond to my, my cohort. Saturdays and Sundays, that's when I did the bulk of my work, writing individual papers. But I found myself, even after, in the evenings after working on discussion conversations, looking, like I said, doing some individual research on my own, you find yourself, you'll be looking up, I'm trying to think of an example, but one thing leads to another, and you get to discover all these different aspects of healthcare. But yes, you can hold a full-time job, be very successful at it, and be very successful at being a student.
Perfect. There's another question regarding internships, and I'm going to have my colleagues, Dr. Harrington and Dr. Ferndeck, address it. Can I do an internship at my present place of employment?
I'll hop in. This is Dr. Harrington. Yeah, sure. The biggest key is if you are looking to do an internship at your place of employment, that we get you outside of your realm. So the purpose of the internship is really to expose you to things that you're not already exposed to. So if you are just going to intern, say, with your manager, you're not likely to get outside of your realm. But especially here in the Pittsburgh area, but obviously nationwide, there are, you know, most organizations have more opportunity outside of what we do. You know, for example, here at Robert Morris, I work in Health Service Administration, but there's a vast opportunity of other things going on here. So a lot of organizations are like that. And if it is more beneficial to you, maybe due to PTO time or flex time or whatever, to work within your organization from an internship perspective, that is certainly something we can work out. We're very flexible with our internships and want people to be exposed to lots of things, but also be able to get their work done and their schoolwork done.
Question for Mark or Tanya, and Tanya. With the internship, have you seen the internship be beneficial in bridging that from the classroom to getting your first job as a healthcare administrator?
I guess I'll jump in there. I can't see how it wouldn't be. As I've said, you know, one of the other questions was, you know, did you consciously make a decision to go into healthcare? And I did not. Healthcare found me. And, you know, I had to adjust and adapt, you know, to have success. And I think that if I would have had the experience to learn some of the things that these students get to learn now before they even get started, it would have been tremendously invaluable. There's something to be said for the school of hard knocks and learning it the hard way, but boy, it's a whole lot easier when you're really well prepared. And I think the students are well prepared when they come into the internship vis-a-vis their educational experience. And I think the experience they have during the internship only rounds that out even more.
Yeah, and I think I would just add that, as was alluded to, there are so many opportunities within healthcare that the internships have really helped people identify really what their passion may be and where they feel that they might be best able to contribute. So, you know, I think that that does just help those individuals make a better choice of how they would like to make contributions within healthcare, and having some actual practical experience is very beneficial.
That was the final question, but I just want to say at the end, you know, we at Robert Morris are ready for you. We're ready to help you in that journey of becoming a healthcare administrator. We are there with all of our support, all of the individuals that are around this virtual table, as well as all of the individuals at the university. We're ready to take that journey with you. And it's not one of those things that you start in the program and, you know, the 2 years goes by very, very quickly. And as I'm sure Lisa will attest to, that, you know, you start and 2 years later you're done. And, you know, it's not something that Lisa talked about our networking and educational events. We have one in the fall and one in the spring, where we bring individuals to the students, and we encourage students to network, because it's such an important thing. You know, Margie talked about networks and how important it is to network. And I think that you'll find with Robert Morris that we support those networks, and we help you find those networks, and we help you excel in what you want to do. And each student is different. Each student gets into the program and does a complete different path. Even though they're studying the same thing, they're not, their end goal is not something that's the same. And we often say, you know, it's not the destination that's so much as the importance, it's the journey by which you get to that destination. And the journey is what we're there to help you with. And at Robert Morris, we're there to help you through the program, but we're there afterwards. You know, it's, you know, I still have students call to say, you know, I'm looking to get a position. Can you help me with my resume? Can you look at my cover letter? Can you what's your suggestions as far as, I'd like to get into this field now. Do you have any networks that I can tap into? And so, you know, it's, you know, and the students will hear me say, it's not what you know, sometimes it's, you know, it's who you know, and that will help you get to where you want to go. And, you know, I often say it's, you know, who you know that gets you in the door, it's what you know that'll keep you in the door. And that the more you learn, the more you need to learn. And you know, healthcare is constantly changing. And my students probably said, I've said that thousands of times, but, you know, we are in a very dynamic situation, in a very dynamic environment. And, you know, at Robert Morris, we're ready to be there with you. We're ready to take that journey alongside of you. And we thank you for participating in this program. If there's any questions or anything that you need after this, I can be reached at hampy@rmu.edu. And we're looking forward to seeing you in the fall and joining cohort number 7. And again, we're ready to go with you. And thank you.